Good morning, everyone. It's 9 a.m. and welcome to our Alaska Collaborative on Health and the Environment teleconference titled Threats to Drinking Water and Public Health in Alaska, the Scope of the PFAS Problem, Consequences of Regulatory Inaction, and Recommendations about ACAT's new report on PFAS contamination in Alaska. We are joined today by Diana DeFazio, primary author of the report, Kelly McLaughlin of Gus Davis, Paul Liedberg of Dillingham, and ACAT Executive Director and IPEN Co-Chair Pamela Miller. My name is Samarisa Guinot Medina, and on behalf of Alaska Community Action on Toxics, I'll be facilitating today's call. SHE Alaska is a regional partnership group of the National Collaborative on Health and the Environment. SHE Alaska aims to advance knowledge and effective action to address growing concerns about the links between human health and environmental factors. You can find more information at acaction.org and healthandenvironment.org. If you did not receive a link to the two presentation documents, please go to www.acaction.org to download the presentation slides, which are posted to our homepage. Keep in mind that this is an audio-only teleconference, not a webinar, so you will need to click through the document yourself to follow along. Our call will last 1 hour. During the last 10 minutes, we will invite your questions and comments. Alaska Community Action on Toxics works at the local, state, federal, and international level to address public health and environmental concerns related to toxic chemicals, including contamination from per- and polyfluoroalkyl substances, known simply as PFAS. There are estimated to be nearly 5,000 compounds in the PFAS class of chemicals. In research and writing this report, our goal was to pull together what is known about PFAS contamination in Alaska, identify gaps and concerns, and make recommendations to inform the public and policymakers about the need for urgent action to protect public health. PFAS are toxic, persistent, bioaccumulative, and have been linked to numerous adverse health outcomes. The PFAS contamination in Alaska today is the result of decades of use of firefighting foams that contain PFAS, known as aqueous film forming foam, or AFFF. To date, more than 100 individual AFFF source areas or nearly 30 locations in Alaska have been identified. PFAS-containing foams continue to be used at military installations, airports, fire training centers, and in emergency response, despite the extensive scientific literature linking exposure to adverse health outcomes and the availability of effective fluorine-free firefighting foams that are now being used at many of the world's largest airports. First, we will be hearing from Diana DeFazio. She's the primary author of ACAT's new PFAS report. Since 2010, Diana DeFazio has coordinated and hosted over 100 of ACAT's monthly SHE Alaska teleconference seminars. Prior to working for ACAT, Diana served for 6 years with the Alaska Marine Conservation Council in Anchorage to facilitate membership and communication projects to support fisheries conservation and Alaska's working waterfronts. She now lives in Oregon. She still cares deeply for Alaska's people and environment and continues to work with ACAT to protect communities, fish, and wildlife from toxic exposures. It's a pleasure to be facilitating this call, having Diana as a presenter. So welcome, Diana. You may go ahead and begin.
Thank you, Sama. Thank you so much. Today I'll be presenting some of the findings of ACAT's new report on PFAS contamination in Alaska, and much more in-depth information can be found within the 75-page report. So if you start with slide 1, that's where I am now. I'll be providing some background, but intend to focus mostly on select sites and communities. Next slide. I do feel I need to give some background on current standards and the process of how PFAS is being discovered in Alaska. Later in the call, Pam Miller will be discussing the report's recommendations. Here's just a basic overview of my presentation. Next slide. So what are PFAS? As Sama said, PFAS stands for per- and polyfluoroalkyl substances, and they used to be referred to as perfluorinated compounds, or PFCs. The PFAS class of chemicals has been in commercial use since the 1940s and now includes nearly 5,000 human-made compounds. And of these, PFAS, PFOS, and PFOA, PFOA, are the most well-studied. PFAS are characterized by their carbon-fluorine bonds, among the strongest chemical bonds, and are described as long chain or short chain, depending on the number of carbons. Next slide. So how are people exposed to PFAS? One route of exposure is numerous consumer products, including nonstick cookware, stain-resistant treatments for furniture and carpets, waterproof outdoor clothing and gear. Anything that says like durable water repellent finish would probably have PFAS in it. Grease-resistant food packaging, including fast food wrappers, parchment paper, and nonstick aluminum foil. And even certain brands of dental floss, the ones that glide, and other personal care products. Next slide. Ingestion is really the primary concern, and that can occur through contact with consumer products, but more likely through food, dust, and water. So for food, ingestion of PFAS, like I said, is the primary concern, and eating food prepared in nonstick cookware or packaged in grease or heat-resistant packaging can expose you to PFAS. Eating livestock raised on PFAS-contaminated feed or in fields where PFAS-contaminated water or biosolids were applied is another way you may ingest PFAS. And produce irrigated with PFAS-contaminated water or grown in contaminated soil is a possible source of exposure. The sign on the lower right is a Golden Hearts Utilities announcement of its suspension of compost sales in Fairbanks earlier this year when PFAS was discovered in the compost that they were selling. Consuming fish and wild game that have PFAS in their bodies is another concern, and something that we don't know a lot about and that we would like to see more testing of fish and wild game to understand how PFAS in their bodies may be accumulating in ours as well. Some ice cream and soda dispensing machines also contain PFAS. Next slide. So as mentioned, dust is one route of exposure, and that is of particular concern for children because of their hand-to-mouth behavior. They're at higher risk of ingesting contaminated household dust. And PFAS releases into groundwater, surface water, air, and soil can contaminate drinking water sources. And that is what we are primarily concerned with, because drinking water exposures represent steady exposure over a long period of time. And we know that these compounds build up in your body and that they can have adverse health impacts at very low levels. Next slide. This is just a collection of headlines. PFAS contamination started making the news in Alaska in 2015 when they were discovered at dangerous levels in drinking water in the Fairbanks area at Eielson Air Force Base and in private wells near the Fairbanks Regional Fire Training Center. Since then, there have been many new PFAS contamination discoveries in Alaska, and many of the headlines here are just from this year alone. Next slide. Since Alaska doesn't have any chemical manufacturing plants that produce PFAS and no factories that make products containing PFAS, the contamination in Alaska can be traced to the use of firefighting foams at airports, military installations, fire training centers, oil and gas facilities, and emergency response sites. AFFF is a type of fire suppressing agent used for Class B fires, and Class B fires are flammable liquid fires. The U.S. Navy, in collaboration with 3M Company, developed AFFF in the 1960s, and in 1969, the Navy issued a military specification requiring the use of AFFF containing PFAS at all military installations. For many decades, these foams contained PFAS and PFOA, but are now being replaced by formulations that also contain harmful PFAS. Airports certified by the FAA that have jet service have also been required to use AFFF and to conduct regular fire trainings and equipment testing to maintain their certification. So over several decades, AFFF has been widely used across Alaska. Next slide. PFAS exposure has been linked to numerous health outcomes. I just have one slide about health effects because this is very well covered in our report. PFAS exposure has been linked to high cholesterol, immune system effects, alteration of mammary gland development, reduction in breastfeeding duration, testicular and kidney cancers, as well as possibly some other cancers, liver damage, ulcerative colitis, pregnancy-induced hypertension, and preeclampsia. Next slide. The Environmental Protection Agency has established non-enforceable health guidelines for certain PFAS. And with the mounting scientific evidence that PFAS compounds are linked to adverse health outcomes, the EPA established a lifetime health advisory level for PFAS and PFOA at 70 parts per trillion, and that is for the combined concentration of these two compounds. And that's for drinking water. However, the scientific literature indicates that the safety level may be as low as 1 part per trillion, up to 700 times lower than EPA's health advisory level, as stated by Dr. Linda Birnbaum, retiring director of the National Institute of Environmental Health Sciences. Federal efforts are underway to consider the establishment of maximum contaminant levels to regulate certain PFAS in the nation's drinking water under the Safe Drinking Water Act. But we wonder, how long will this take? Which PFAS will be included? And what will be determined to be a safe level? How many people will continue to be exposed during this process? Next slide. In August 2018, the state of Alaska established action levels and guidance for the sum of 5 PFAS at 70 parts per trillion, and this included the compounds listed in the first bullet. In April 2019, under the new Dunleavy administration, this was changed to considering only the sum of PFAS and PFOA, and the total combined concentration of 70 parts per trillion, the same as EPA's lifetime health advisory level. Just earlier this month, the state announced that testing will report the full suite of PFAS compounds. It will still only require alternative drinking water be provided based only on PFAS and PFOA results. And that's important. So we'll be able to see the full range of what may be in the water, but action will only be initiated if the PFAS and PFOA levels meet that threshold of 70 parts per trillion. For airport sites, the analytical method generally used analyzes for 18 compounds. This change is important because it will enable regulators to look back at results should standards become more stringent. So we're pleased that the state decided to do this. But we think that we should be testing for more that we should be evaluating safety of drinking water based on additional PFAS compounds. An increasing number of states are establishing health protective regulations more stringent than EPA's lifetime health advisory. Yet, the state of Alaska rolled back protections, choosing to base decisions on only 2 PFAS compounds. And again, that's PFAS and PFOA. Next slide. This memo was sent by a manager within DEC's Contaminated Sites program to her supervisor after the rollback and is worth reading in full. In reference to the weakening of standards, she states that these actions have been taken against the recommendations of career, environmental, and public health professionals in both DEC and the Department of Health and Social Services. The best way to protect our citizens of the state of Alaska is not by rolling back standards. Such action goes against our responsibility as environmental and health professionals to ensure the drinking water of Alaskans is safe. As a science-based agency, we must use a science-based approach to set standards. Investigation all potential contaminated areas and receptors, require complete reporting of all analytes, and do all that we can to protect Alaskans and the environment from additional exposures to PFAS. That's our job. To do otherwise is negligence. Next slide. So the information presented in our report was obtained through hundreds of documents that we reviewed, including reports, laboratory results, and letters between DEC or EPA and the Department of Defense. Our Freedom of Information Act request yielded fewer results than our requests to DEC, and some requests have not been fulfilled now, 6 months later. We also analyzed laboratory results with special attention to the comparison of August 2018 and April 2019 action levels. And I had numerous conversations with DEC project managers and other DEC staff and Department of Defense staff. And generally, DEC staff were quite helpful in providing background information to help us better understand the sites. I had quite a bit less communication with Department of Defense staff. Next slide. So this is we're on slide 14, if anyone joined us late and needs to orient themselves. This is an interactive map, DEC's Contaminated Sites program, of DEC identified PFAS-contaminated sites in Alaska. It's available online, and I've provided a link. You can zoom in, click on a green marker, and learn more about each site. In case the distinction I make between sites and locations is confusing, there's a green marker for each specific source area where PFAS contamination has been identified. For example, a specific airplane hangar or fire training pit, or in the case of airports, possibly a crash site, as well as an AFFF training and testing area. Some locations, such as Eielson Air Force Base and Fairbanks and Joint Base Elmendorf-Richardson and Anchorage, for example, have numerous source areas that are being tracked and managed separately by the Contaminated Sites Program. So that's where you'll see the big cluster of green dots, is where there are maybe 15, for example, AFFF source areas at one of at Joint Base Elmendorf-Richardson, for example. Next slide. We found that there are 10 locations with drinking water sources contaminated with PFAS. Most of these locations will already be known to Alaskans, as they have been reported in the news media. Erickson Air Station is not typically included within the lists provided by the administration when they talk about contaminated drinking water, but I'll show a little later why we include it here. Next slide. So whether the Department of Defense or State of Alaska is investigating the presence or absence of PFAS at a site, this is the general process. First, identifying places where AFFF may have been dispersed into the environment and evaluating whether PFAS has the potential to impact drinking water sources. And if at any point PFAS is found to be at or above action levels, the responsible party must provide an alternative drinking water supply. So for many of the airports, this would be the Alaska Department of Transportation and Public Facilities. For the Department of Defense sites, it would be the Air Force, Navy, or Army, just as an example. Some of the sites, the responsible party is a municipality. Repeated rounds of testing, expanding outward from the source, are then conducted by consultants hired by DEC or DOD to determine the extent of contamination. And later comes a more further site characterization, and eventually the goal is to implement a longer-term solution for drinking water supply and remediation. Next slide. The Department of Defense PFAS investigations begin with assessing the site per the CERCLA, also known as Superfund process. So the Department of Defense is undertaking a nationwide assessment of military installations, looking at PFAS in soil and groundwater, and trying to figure out whether or not drinking water sources may be affected. That sort of prioritizes the sites for being investigated. The DOD looked at bases with DOD supplied water that's on base, where the water comes from directly underneath the base first. And they encouraged installations with a private water provider to test for PFAS, but they don't require that. And examples of installations with private party utilities providing the water would be Fort Greely and Fort Wainwright, or Army sites. And then JBER gets its water from another off base, but it also receives water through a private utility. And all three of those are with Doyon utilities. The earliest testing occurred in 2012 at some sites as part of existing groundwater monitoring efforts. What's really important is that no PFAS are recognized as hazardous substances under CERCLA, and this hinders assessment, site characterization, and remediation. The preliminary assessment is the first step in the CERCLA process, and its purpose is to determine whether or not there's a potential threat to human health warranting further investigation. It may include collection of historical, ecological, and other information, interviews with current and past personnel who may know about the history of AFFF use, or about an accidental release that occurred, or how it was stored, site visits, and research online to identify potential AFFF sources. And based on the information collected, the PA makes a formal recommendation for further action or no action, and sets priority for sampling locations. So again, the lack of definitive action by EPA and consistent enforceable federal regulations is hindering PFAS investigation and remediation efforts across the nation and in Alaska. We believe that the DoD is using the lack of designation of any PFAS as hazardous substances under CERCLA as a loophole to delay site characterization, sampling, and remediation. Next slide. This table has a lot of information that you may want to look at more closely. One thing to point out is that at Fort Greely and Fort Wainwright, PFAS testing has only occurred as part of other groundwater monitoring or sampling events. There's been no base-wide identification or sampling of known or suspected AFFF release areas. Therefore, these data on highest concentrations cannot be considered representative of PFAS concentrations at these two military installations. The year listed is the year the sample with the highest concentration was taken, but PFAS sampling may have taken place in other years. You can see that the highest concentrations of PFAS in groundwater at the 11 Department of Defense sites that the DoD identified for sampling are Eielson, Galena, and King Salmon. Next slide. The Alaska Department of Environmental Conservation and the Department of Transportation and Public Facilities has identified 33 airports where AFFF has been used where potential impacts to drinking water sources should be evaluated. And in addition, DEC's Contaminated Sites program has investigated PFAS contamination at fire training centers and emergency response locations. Next slide. Here's another table. This table listing the 33 airports identified by the state of Alaska for PFAS evaluation contains more information than I can cover here, but I did want to draw your attention to it if you want to know the status of a specific airport. All 33 are listed and they continue on to the next slide. Many people have asked about Ted Stevens International Airport and the Juneau Airport, and I can say that both are in the very early stages of investigation. Impacts to drinking water are not a concern for Juneau Airport because there are no drinking water sources nearby. Airports where PFAS contamination is impacting private or public water supplies nearby are indicated in bold, and these include Fairbanks, Utqiagvik, Gustavus, Dillingham, King Salmon, and Yakutat. Only 13 of the 33 airports have been investigated to date. And if you get to the next slide, you'll see the remainder of the table. So now we're moving on to the individual sites and communities. For the remainder of the presentation, I'll be going through some selected sites, highlighting specific concerns that we've identified. This map of the Greater Fairbanks area does not include labels for 2 fire emergency response locations where AFFF was used, a fire in 2017 at Bloom Enterprises and in 2011 at Napa Auto Parts. And these are both located near the Fairbanks Regional Fire Training Center. Next slide. I think it worth mentioning that in addition to widespread PFAS contamination of Fairbanks area groundwater from the several PFAS plumes that I mentioned before, the PFAS problem in the Greater Fairbanks area is noteworthy on a national level. The city of Fairbanks has joined in a suit against 3M and Tyco Fire Products, the manufacturers of the AFFF that is contaminating drinking water. And the community of Moose Creek is one of 8 places nationwide that the Centers for Disease Control and Prevention and the Agency for Toxic Substances Disease Registry selected to study exposures by measuring PFAS in the bodies of residents who choose to participate in the study, which to my knowledge has not yet begun. The study has not begun, but you can find out more information about that online. Next slide. Fairbanks Regional Fire Training Center was one of the first places in Fairbanks discovered to be contaminating nearby drinking water. This is a map of testing results from private wells near the Fairbanks Regional Fire Training Center. And the red dots indicate those wells exceeding EPA's lifetime health advisory of 70 parts per trillion. Properties with contaminated wells are being connected to the public water system. And I'm going to talk a little bit later about the public water system because we're not so sure that that's a viable, safe alternative because there are PFAS compounds in the water, not at levels, they're at pretty low levels, but we still feel that connecting people with contaminated wells to a lesser source of contamination is really not enough to protect health. Another concern that the mayor of Fairbanks, Bryce Ward, has expressed, as well as others in DEC and EPA, is the potential that residents will continue to use private wells for purposes other than drinking water, which could result in further disbursement of PFAS in the area. And this is for all of those sites, that question of what happens to these wells once somebody's not using them for drinking water anymore. Next slide. We're on slide 25. Fairbanks International Airport, similar map. These properties were impacted by the PFAS plume from the airport. They're still being impacted and are also being connected to the public water system. And you can see by the concentration of red dots indicating individual wells that a large percentage of people in this area have been impacted. Next slide. We're on Eielson Air Force Base in Moose Creek. PFAS were discovered in groundwater at Eielson Air Force Base in 2012. That's quite a long time ago, at which time DEC requested that the Air Force test the on-base drinking water supply, and the Air Force did not. Then in early 2015, EPA requested that the water supply be tested, and shortly thereafter, the Air Force conducted testing. Results confirmed that on-base drinking water supply was contaminated, and a GAC filter installed failed to remove the PFAS to safe levels. A new system was installed in spring 2016, and testing results indicate that this filter is effective at removing PFAS and PFOA. Given the high levels of PFAS in groundwater at Eielson, testing of private wells in Moose Creek occurred in 2015, and it was confirmed that PFAS had migrated off base, and that's generally how it works. If there's a high concentration of PFAS in the groundwater at a site, the next question to ask is, where is it moving? Where might this contaminant be traveling? And who might be a receptor? 169 of the 174 private wells that were tested in Moose Creek had concentrations of PFAS above action levels, with results ranging from 83 parts per trillion to 2,222 parts per trillion. Next slide. So I want to talk a little bit about our concerns about PFAS in the Fairbanks public water supply. One of our concerns in reviewing annual water quality reports and other documents is the fact that the public water supply has PFAS at levels that we do not believe are safe. We do not believe that connecting private well owners to contaminated water supply is a viable solution to protect public health, as I mentioned. 2 utilities provide water to the city of Fairbanks: Golden Heart Utilities and College Utilities Corporation, and both of these utilities obtain their water from the same source, which is 4 supply wells on the Chena River, which happen to be located really quite close to Fort Wainwright. Next slide. This is a map of Fort Wainwright. So there's very little information available about PFAS at Fort Wainwright. The Army has not released its preliminary assessment to DEC or EPA, despite requests. And remember, the preliminary assessment identifies potential AFFF source areas to determine if there's a threat to human health, and it determines future actions that are based on this early assessment. So the lack of an assessment really means that nothing can happen. Joyon Utilities provides on-base drinking water, and testing began in 2017. Levels of PFAS have been detected at slightly above 2 parts per trillion in one of the 2 main supply wells. So as far as off-site migration, the purpose of my including this map here is to show that the 4 Golden Heart Utility supply wells, which again supply all of Fairbanks public water system, and they're circled with the larger circle. They're located on the Chena River, roughly 1 mile down gradient from the base boundary, from the western boundary of the base. And the smaller circle within the boundary shows the fire protection well where PFAS and PFOA have been detected at the highest levels of the wells so far tested at Fort Wainwright. We're concerned by the lack of progress on site assessment at Fort Wainwright, given its close proximity to the public water supply wells. And the sampling of potential AFFF release areas is planned for summer 2020. So hopefully that will occur on schedule. Next slide. Also in the Fairbanks area is the North Pole Refinery, the former refinery. So in North Pole, we know that private wells are contaminated from historic AFFF use at the former refinery. And sampling efforts to date have included testing in a 6 square mile area to the north and northwest of the refinery. So that shows just how far there's concern, how far from the actual source that DEC is concerned that it can show up in the groundwater. And that's based on some existing monitoring wells that are in the area as well, that they were able to test that far out quickly. We also know that fish in Kimberly Lake are contaminated. And on April 3rd, 2019, the Alaska Department of Fish and Game issued an emergency order closing the lake to fishing. And I'll say a little bit more about this shortly. And there's also the possibility that PFAS contamination may be originating from the North Pole Fire Department, where trainings included dispersing AFFF as described in this training roster, which is a little difficult to read, it's kind of small. A monitoring well that is up gradient from the North Pole refinery, yet down gradient from the fire department, had high levels of PFAS, indicating that this may be an additional source of contamination other than the former refinery. And this area is not currently under investigation, the North Pole Fire Department, that is. Next slide. This slide summarizes Kimberly Lake fish tissue sampling, and I want to point out that if we were to apply the fish consumption advisory levels for PFAS that New Jersey established, it would only be safe to consume fish from Kimberly Lake once every 3 months, and it would be unsafe for high-risk populations, which would include children, pregnant women. It would be unsafe for them to eat them at all. Polaris Lake fish have also been tested, and that lake was closed to fishing on April 3rd as well. And the Ruth Barnett Fish Hatchery fish have also been tested, and PFAS were not detected in the hatchery fish. Next slide. Moving on now to Utqiagvik, and where PFAS contamination of surface waters is originating from 2 general areas. The first is the formal Naval Arctic Research Laboratory. The AFFF source area is the airstrip where AFFF was likely used during emergency response to 2 airplane crashes in the 1970s. The contamination of Amikpuk Lake shows just how persistent PFAS and PFOA are, and that emergency response that occurred nearly 50 years ago can have consequences today. Next slide. Now we're moving to the airport at Utqiagvik, and the reservoir that is right near the airport serves as the public water source for Utqiagvik's 4,000 residents. As you can see, the end of the airstrip borders the reservoir. The airstrip is that horizontal line, pretty prominent in the map. Concentrations of PFAS and PFOA have been detected at the highest levels in surface water samples taken near the end of the airstrip, and those results are provided in our report. The public utility has taken routine monthly samples from the raw water and treated water since August 2017, when contamination was first discovered. Water is treated using reverse osmosis. So the water that doesn't pass through the filter is discharged into Isopcoic Lagoon, which is the round water body to the left of the reservoir. And about 20% of the water does not pass through the filter. So this concentrated PFAS water is being deposited into that lagoon. We could assume that if that water were tested and it has not, it would show high concentrations of PFAS. According to the EPA, reverse osmosis technology is effective at removing PFAS and PFOA, but does not necessarily remove other shorter chain PFAS, which are increasingly being used today. Next slide. This is Erickson Air Station on Shemya Island in the Aleutians. Here I have a table showing a comparison of pre and post water treatment results at Erickson. The first thing to note is that Erickson uses conventional water treatment, which we already know is not effective at removing PFAS, and these results, which are nearly identical pre and post treatment, clearly show this. The second thing to notice in this table is that the concentrations of PFHXS are relatively high, something we saw in laboratory results from sites across Alaska. We emphasize PFHXS results in the report since these are no longer being evaluated as a basis for action by DEC, and inclusion or exclusion of PFHXS results in several cases makes the difference between a community receiving or not receiving alternative drinking water. We believe the Air Force has consistently minimized the PFAS problem and potential impacts to drinking water safety at Erickson Air Station. It took no action to provide alternative drinking water when testing of the water source in March 2017 showed 100 parts per trillion for PFAS and 20 parts per trillion for PFOA, which is above EPA's lifetime health advisory. Next slide. Now we're moving to the Anchorage area. On-base drinking water is not a primary concern for this location, as the base receives its water from Upper Ship Creek. Primary concerns are related to off-site migration into Ship Creek and Cook Inlet, and wastewater discharged into Cook Inlet. And it's worth noting that the Air Force does not have any plans to investigate off-site migration of PFAS from JBER, and I confirmed this numerous times with project manager for JBER and Coulis Air National Guard Base, the former Air National Guard Base, that there are no plans for off-site migration investigation for JBER at this time. We're concerned about potential impacts to salmon and other fish and wildlife that rely on Ship Creek, and also the fact that the Cherry Hill Ditch, which directs stormwater from a number of the identified AFFF source areas, empties into Knik Arm. DEC has stated that the Air Force is out of compliance with the terms of federal facility agreements because it is not scheduling and investigating PFAS and PFOA source areas in a timelier manner in accordance with CERCLA. Wastewater from JBER is transported to Port Warrenzoff and discharged into Cook Inlet, and we just don't know much about what ecological impacts this might have on marine life. And we're on slide 35, but we're now moving on to the next slide. The former Coulis Air National Guard Base is now the Coulis Business Park, and it's located adjacent to Ted Stevens International Airport in Anchorage. The Air Force has identified the potential for off-site migration to impact private drinking water wells. And most properties have been connected to the municipal water system, so it's unclear how many of the 300 wells within a 1-mile radius of Coulis are currently in use. The Air Force initially indicated that it would be testing wells in summer of 2019, but that time has already passed. DEC staff made a request last month that the Air Force sample the private wells as soon as possible, and DEC stated that DEC is concerned the sampling of the wells identified in the site inspection report published in March has not yet occurred, and receptors are potentially exposed to unacceptable levels of PFOA and PFAS. In August 2019, the Air Force indicated its plans to sample the wells in April of 2020, nearly a year later than originally planned. Another concern is the potential for off-site migration to impact wetlands, lakes, fish, and wildlife. Drainage ditches direct stormwater runoff to the east to Meadow Lake and DeLong Lake and the surrounding wetlands. DeLong Lake is stocked with fish. We also believe the investigation of off-site migration of PFAS should include an evaluation of any possible exposure routes that might affect children and staff at Kincaid Elementary, which is just 550 feet to the south, and Sand Lake Elementary School about a half mile to the southeast. Next slide. I include this map because it shows the wetlands, lakes, and ponds that are adjacent to Coulis. There's not much more to say about it. You can look at it and see just how many sensitive areas there are, and that is in the general direction that they believe the groundwater to be flowing. And the surface water from the drainage ditch does run right there towards DeLong Lake. Groundwater at Galena's now closed forward operating location was first tested in 2012. We're on slide 38 and exceeded EPA's provisionally health advisory level. I'm not going to go over the information in this slide, but I do want to draw your attention to the extremely high levels of PFAS and PFOA found in groundwater at Galena. These are among the highest detected in Alaska. There's a map in the report that shows the proximity of AFFF source areas to private wells and to the Yukon River. You can take a look at that in the report. And fish and people who consume them are identified as potential receptors in the Air Force preliminary assessment, but there are no plans at this time to test fish to know whether or not they are contaminated. Next slide. Now we're in Southeast Alaska at Gustavus. Initial sampling in Gustavus was conducted in 2018 and confirmed PFAS contamination of groundwater, prompting a private well search and sampling. Of particular concern was that PFAS were detected above action levels at the airport well and the National Park Service well. Next slide is a map showing the highest concentrations of PFAS detected since testing began in August 2018 through the quarterly testing that occurred in April 2019. And again, you can see, the clusters of red indicate the highest detections. Next slide. So when the Gustavus community first found out what was happening and that they had been drinking contaminated water possibly for decades, They attended the public informational meetings that were held by the administration and DEC, and many residents left with more questions than answers and joined together to form the Gustavus PFAS Action Coalition, or GPAC. And I'm now going to have one of the people from the impacted community speak. Our next guest is Gustavus resident Kelly McLaughlin, who is chair of GPAC and intimately knows what it's like to discover that the water that your family, including a toddler, has been drinking is contaminated at twice the levels deemed safe by the EPA. Her family has been living off 5-gallon jugs of water delivered by the Alaska Department of Transportation and Public Facilities for over a year now and has had to adapt to life without potable running water. And we're going to return to this presentation, so keep it open. There still are a few more slides. But as I mentioned, Kelly is chair of the Gustavus PFAS Action Coalition, and we've invited her to talk a little about the wild game testing that the state conducted at the request of GPAC and how her community has worked to have a seat at the table, contributing local knowledge and raising community concerns throughout the state's process to investigate PFAS contamination in her community. Welcome, Kelly.
Thank you, Diana. Yeah, so I mean, the seat at the table thing it's very important, and I don't think we really knew that when we started out, but that became really evident that there was not a lot of information regarding these chemicals. There was no regulation on them ever, and so there's no documentation of when and where they were used, and even tracking records to sort of uncover where and when they were used. They're all very loose records. So community knowledge is invaluable in this situation. We originally, actually, the game testing happened before GPAC even formed. It was sort of in the early stages, but it was during moose season, and I just emailed Fish and Game and said, hey, would you be interested in, like, I can go around and collect a bunch of moose samples. People are cutting them up. And then I can hold them for you until you're interested. And they said, well, maybe not. And then there was some more interest, I think. Some more requests came their way, and they decided that they would gather as many samples as they could, which ended up being, I think, 11 or so. So not a huge number, but a good representation of moose and Gustavus, and one bear. So that was an interesting comparison. And thanks to Roy Churchwell for Fish and Game for pushing that forward. So the results came back, and I'm not sure what the level of non-detect was, but it's fairly high. I think I want to say 0.2 parts per billion. That may be wrong, so I probably shouldn't say anything. But they all came back non-detect in moose meat. The liver all came back with detections of PFAS or PFOS mostly. Yeah, everything was under 1,000 parts per trillion, except the bear, being a bioaccumulator, eating animals and things other than moose consume. I think the moose exposure was mostly based on water. So that was pretty scary to know that even just the broad range of emotion that a moose has in Gustavus, they are still picking up this chemical. And then you compare that, the little bit of exposure that the moose have, and that it's still showing up in numbers. And if the EPA says 70 parts per trillion for water, and the moose are all around 1,000 in their livers, that doesn't seem safe to me. But you compare that to fish that are living in the water and eating things that are living in the water, and the fish in Kimberly Lake that Diana talked about, they were stocked in that lake less than a year before they were tested, and they were up at 90,000 parts per trillion in a lake that is at 122 parts per trillion. So, I mean, the fish thing, I cannot believe that it's not an enormous red flag for the state that we're not testing every fish that we catch. And the salmon life cycle starts in the river. We know that the rivers around Southeast and around the state are potentially contaminated. I think that's an extremely important next step. And if you think about the the science that's been coming out, that it seems like the levels go down and down and down, and the states that are regulating this chemical. The levels are lower and lower and lower. And I feel really strongly that there's no safe level until a safe level is proven, and we haven't seen that. So I think that DHSS determined that the moose meat was safe to eat, but I do not feel that way at all. I absolutely don't think that fish in Kimberly Lake is safe to eat ever, not once in 3 months, not ever. I mean, that's just astronomical levels of this stuff. And the other part of the seat at the table thing that we did was to push for some local knowledge to be included in the site characterization. And I heard from Shannon and Wilson, who's the contracting company for DOT, that was the first time that a work plan had been put out to public comment. So we felt pretty good about that, working with DOT and working with Shannon and Wilson to put our local knowledge to work. They really didn't know which way the water flows and which areas were potentially contaminated. So it was wonderful to have the minds of Gustavus give feedback, and that feedback was listened to for the most part. So feeling pretty good about that.
We're now on slide 42, which is Dillingham. And the properties near the Dillingham Airport were first tested in December 2018. PFAS were discovered at the Holy Rosary Church well, and this is a public community water system serving roughly 300 people who depend on the water supply year-round. They fill their jugs there because they have a lot of rust and sulfur in their wells. There's also a city water supply, but it doesn't serve the area near the airport. So the results of the church well were 186 parts per trillion for the sum of 5 PFAS and 42 parts per trillion for the sum of PFAS and PFOA only. And this is super important, again, because this is the difference between whether you're counting all 5 or just the 2, and how it can affect whether you get alternative drinking water. So if this had been tested in April, none of the well testing that has occurred out in Dillingham would have happened. And on the next slide 43, they started with 9 wells, and then in March, there were 65 wells that were looked at, 56 plus the 9 original ones. And I just put this side by side here to show how the investigations work. And now I'd like to invite Dillingham resident Paul Liedberg to offer community perspective on how the PFAS contamination is impacting Dillingham residents. And Paul Liedberg is a 15-year resident of Dillingham. While there, he served on the Planning Commission for 10 years, including 3 years as the chair, and served 7 years on the City Council. Paul currently chairs a new organization titled Friends of the Dillingham Landfill that explore and advance ideas to help their landfill be more sustainable. Paul retired in 2012 after a 36-year career with the National Wildlife Refuge System of the U.S. Fish and Wildlife Service. And in his last position, he managed the Togiak National Wildlife Refuge based in Dillingham. So welcome, Paul.
Thanks, Diana. I'm going to keep this very brief because I know we are running short. You asked that I talk about concerns that the community of Dillingham had related to PFAS and testing that has been done in coordination probably with the state. And so I'm just going to concentrate on that. I'll just say one thing that probably if I was to make a overall comment, it would be that the community has certainly concern, but probably hasn't risen to the point of alarm over the issue. And there's probably a couple of reasons for that. The region is totally committed and busy with other issues related, one being to the Pebble Mine, of course, that everybody is aware of, and that's taken a lot of time from everybody in the concentration. Another issue related basically to the city's involvement with an issue like this is just the challenges that rural communities are facing now in this age, and financial as well as otherwise. So I think that's part of the reason that there hasn't been more involvement in our area over the issue from either the city government or other entities. So just moving on to concerns that I guess I've heard for the community, and I should say that my well is not one of those that is included here that has been detected for contamination, and I don't have any reason to expect that it would be. We have a fairly low number in the community. In the community of 2,400, we have a fairly low number of wells that have shown contamination, and feel pretty confident at this point, or pretty assured that the area has been characterized, and we know which sites actually are contaminated, and that there won't be more. I guess if there's concerns from the community, I guess the things that I've heard and the things that I understand is that certainly there's been well-intentioned responses by the state, but people, especially those that are affected by this, feel some frustration in not getting definitive answers from the state. And of course that goes both ways, asking for those answers as well as receiving them from initiation by the state. But there is some frustration with that, and I think that's something that we can work on more from both sides. I think there's been somewhat a lack of communication with local government. In this case, with the city government would be the most logical one here, but there hasn't really been much coordination between the state and the city government on the issue, or being updated regularly on what's being done and what's in store for the future. I think a last one, I guess, that I would point out, Kelly talked about having success working with the contractor on delineating future testing, and we haven't been successful on that. I have worked on that a little bit, but we weren't successful on the second round of testing in getting some input to the contractor from our local perspective and local knowledge. So that's been a concern, I guess, as well. So I'll leave it kind of at that, and there's more that can be done certainly on both sides. Again, I guess I would just summarize by saying concern exists, but I guess it hasn't risen to the level of the alarm at this point, and I guess some of that certainly relates to what the response from the state has been on providing alternative sources at this point. So I'll leave it at that, Diana, unless there's questions, but thank you.
Thank you, Paul. We'll hopefully have a few minutes for questions at the end, so I appreciate that. I'm actually going to skip the next two sites, King Salmon and Yakutat, in the interest of time, but please look at the report. They're discussed in depth in the report. And slide 46, if you advance there, I outlined some additional concerns that we have of evaluating wastewater, landfills, and other potential sources of PFAS contamination, testing of fish and game and other wild foods, which has been mentioned, continued non-potable use of PFAS contaminated wells, also the approval of a permit for organic incineration technologies in Fairbanks to incinerate soil contaminated with PFAS, and the high levels of PFHXS often detected at the second highest concentration after PFAS, but not included in current health action levels. So there's one more slide on PFHXS, which you can look at. And then, of course, I want to thank everyone who contributed to this report. And that's on slide 48. And slide 49 has additional resources and links. So it's not an exhaustive list. And I must stop now. I want to make sure that we can hear from Pam and have a little bit of time for questions. Thank you.
Thank you, Diana. Thank you so much. And thank you, Kelly and Paul, for bringing the voice of the community to this presentation. Before we open the call to your questions, I'd like to invite Pamela Miller to discuss highlights of the recommendations made in the report and to give us an update on decisions made at a meeting in Rome earlier this month. The meeting of the International Scientific Panel of Experts known as the Persistent Organic Pollutants Review Committee, or POPROC, included decisions to advance PFHXS as well as other PFAS compounds towards global elimination. Pamela Miller is the founder and executive director of Alaska Community Action on Toxics, ACAT, and co-chair of the International Pollutants Elimination Network, IPEN. Her full bio can be found on our website, acaction.org. Welcome, Pamela. You may go ahead and begin.
Thank you, Sama. And first of all, I just want to begin by giving Diana a huge thanks for the months of hard, careful, and detailed work that went into this report. And thank you, Diana, and also thank you to the peer reviewers of the report. So I'm just going to briefly talk about the recommendations, which are found at the end of the report. But before I do that, I want to say that this is a public health crisis, and this was recognized by a top official at the Centers for Disease Control who said that this is one of the most seminal public health challenges for the next decade. This affects thousands of people in Alaska, over 150 million people, 110 million people throughout the United States have levels of these PFAS compounds in their drinking water of concern to public health. State and federal agencies, I believe, are negligent, and we really need to call upon our state and federal elected officials to take action, and they need to hear from Alaskans about this. So here is, I'm just going to briefly run through the recommendations. First of all, we believe that it's very important to stop further harm by prohibiting any further use of firefighting foams that contain PFAS. We believe that state and federal agencies should prevent further water contamination and harm by prohibiting any further use of AFFF at military installations, airports, fire training centers, and industrial facilities. They should require replacement of AFFF with safe, non-fluorinated alternatives that are widely available, they're effective, they meet the necessary certifications, and they're widely available. And as Diana noted, they're already in major use at airports, defense sites, oil and gas facilities around the world. We further caution against the replacement of other PFAS substances, the short-chain substances, in firefighting foam because we have fluorine-free alternatives. So we should not rely on short-chain alternatives that have many of the same toxicological properties as do AFFF-based firefighting foams. And I am happy to say that at the federal level, under the auspices of the discussions around the National Defense Authorization Act, that there is serious discussion in Congress about eliminating PFAS and firefighting foam, and please contact our senators and representatives to let them know that this is a really critical public health issue. And we also need to call upon our state legislature. Many other states around the country have or are in the process of eliminating PFAS and firefighting foam. Just in 2018, the state of Washington and now a number of other states have already begun or enacted laws to prohibit PFAS-based firefighting foam. Secondly, we really believe that it's important and critical to establish health protective drinking water standards. We currently do not have any enforceable drinking water standards that are health protective, and again, other states are moving forward with this. Most recently, New Hampshire established levels at the low part per trillion level, many times lower than the current EPA health guideline level. And as Diana and Kelly have noted, it's very important to conduct a comprehensive monitoring program, not only of water, but to look at fish. And Kelly noted why fish are really a priority given their propensity to bioaccumulate these PFAS chemicals, but also garden produce and wild plants that are used for food or medicine and other wildlife. Monitoring should include vulnerable receiving waters, lands, wetlands, and communities in proximity to military bases, aviation facilities, fire training areas, oil and gas, and mining operations as well. And next, it's really critical to provide safe water. And Diana noted some of the problems that Fairbanks is dealing with, that the public water supply already contains PFAS, so we really need to look for truly safe water to replace contaminated water sources. Ensuring responsible cleanup is also very critical, requiring biomonitoring and medical monitoring for people potentially exposed to PFAS, and also address occupational exposures and assess adverse effects on firefighters and other workers. We know that workers, for example, at the Golden Heart Utilities compost facility are likely to have been exposed because of the contamination of biosolids in the compost at that facility. Firefighters are extremely vulnerable and already have high rates of cancer and other diseases associated with occupational exposures to toxic chemicals. And the last few of these, we really would like to see regulation of the class of PFAS chemicals. This is a complex group of chemicals of close to 5,000 chemicals in this class. We can't simply regulate them on a chemical by chemical basis. So they need to be regulated as a class under the Clean Water Act, the Comprehensive Environmental Response, Compensation and Liability Act. This is what Diana is referring to as CERCLA, or the Superfund Law, the Toxics Release Inventory, as well as the Resource Conservation and Recovery Act. We also would like to see the prohibition of the use of PFAS in consumer products, including and especially food contact materials. And as Kelly addressed, the importance of, and this is the final recommendation, providing community members a seat at the table, to value and include community members as critical participants in decision making, including the design of sampling, monitoring, and cleanup plans, legislation, and regulatory actions. Nothing about us without us is a phrase that has been adopted by the National PFAS Community Coalition. We would like the agencies to be fully transparent and honest with affected workers, community members, and the general public in all action steps taken to address PFAS contamination. So now I'd like to move to the next slide and just briefly mention these three reports by the International Pollutants Elimination Network, prepared by an expert panel on PFAS and alternatives. These are available at the IPEN website. These look at PFAS as a global issue because these chemicals are subject to long-range transport. They're persistent, bioaccumulative, and toxic. They are contaminating the planet, including remote regions where they've never been produced or used, including the Arctic and Antarctic. And finally, I'd like to mention that under the Stockholm Convention on Persistent Organic Pollutants, which is a global, legally binding treaty, now including 182 nations that are party to the convention, that several PFAS have been listed under the convention, including PFOS, which was listed in 2009, with major loopholes closed by the Conference of the Parties in 2019. PFOA was listed in 2019 for global elimination with some time-limited exemptions. And finally, just a couple of weeks ago, the expert committee of the Stockholm Convention, the POPs Review Committee, recommended global listing with no exemptions of PFHXS. And I should say that this includes not only these compounds that are named, but associated precursors. So there are many, many more compounds that are included in this listing than just the ones directly named here. And next slide is of IPEN. I just want to mention that this is a global network, a very powerful network of 500 organizations working in more than 100 countries around the world on chemicals policies that address the global threat that chemicals pose to health and the environment. And that's all I have. Thank you very much.
Thank you so much, Pam. So we are several minutes past the hour, but I would like to invite people to maybe one or two quick questions or comments. If you would like to ask a question, please press *2 to unmute your line.
Hi, this is Louis with the Alaska Center. I was wondering what state-level actions could be taken in the near term on this.
Is Pam still on the line, or did she have to go? This is Diana. But I think that the most important thing that we can really do is to, continue advocating that the state change the levels that they're looking at and make them more health protective. Alaska, to my knowledge, is the only state in the nation that had stronger standards and then made them weaker. And so just whatever we can do to work with the state to change that, to look at a fuller number of PFAS to determine whether drinking water is safe or unsafe, and in addition to lower those numbers of what that threshold is at which somebody would receive an alternative drinking water supply. I think that's the single most important thing that we can do.
Thank you so much, Diana. Is there any other questions or comments before we close the call? Okay, so is there any final remarks that the speakers would like to share with us before I finalize the call?
This is Diana, and I just want to really thank Paul and Kelly both for joining, and really all of the community members for their contributions and conversations with me over the course of time and in working with ACAT on this important issue at the state and federal level. So I just wanted to, take the opportunity to thank the people in the impacted communities who are really feeling the effects of this contamination. And I guess I want to say again, there's so much in that report on each of those sites. So if there's a particular area of interest, delve into it. I encourage you to check out the resources that are available online through the state. Each of those airport sites has a page with updated maps that show quarterly testing, and just look to that for information. Call them if you have questions. Feel free to contact me if I can help you. I will. And I think that's all I'd like to say.
Okay.
I want to thank everyone.
So thank you. Again, I want to thank all of you for participating today. If you have additional questions or comments, please feel free to contact us by calling 907-222-7714. And finally, I hope you will consider making a donation to Alaska Community Action on Toxics to support our monthly Che Alaska calls. Your contribution will help provide the support we need to continue bringing these calls every month. You can give online at www.akaction.org. Thanks again to everyone and have a wonderful day. Thank you.